Good evening. You are tuning in to AWANI Tonight with me, Cynthia Ng. Putrajaya set to raise statutory debt limit to 65% of GDP. And we take a closer look at how to break the stigma surrounding mental health. That's coming up. After getting a key amendment passed in the Dewan Rakyat, Putrajaya is set to raise the statutory debt limit again to 65% of the country's GDP until 2023. This as the government intends to boost its COVID-19 fund to 110 billion ringgit from 65 billion ringgit.
Finance Minister Tengku Datuk Sri Zafrul Tengku Abdul Aziz said the government is 5 billion ringgit short of reaching the threshold in September. He said it had spent a total of 60 billion ringgit in efforts to combat the COVID-19 pandemic since the start of 2021. The increase will allow more government expenditure, with 45 billion ringgit in extra funding on economic aid and stimulus packages. In 2020, the debt ceiling was raised to 60%, the first increase since July 2009.
All businesses in the distribution sectors no longer require a letter of permission to operate through the COVID-19 information management system. This is following the government's decision to lift the interstate travel ban today.
Domestic Trade and Consumer Affairs Minister Datuk Sri Alexander Nantalinggi said since all distribution, trade and retail sectors have been allowed to operate fully, the letter is now considered obsolete. Each sector is still subject to the SOPs under the National Recovery Plan, especially for the states in Phase 2 and Phase 3. He said the ministry will continue the inspection and monitoring of the enforcement of SOP compliance.
Individuals living in the Klang Valley who have not been given a COVID-19 vaccination appointment or have yet to receive their second dose can walk in at selected private clinics to get their jabs for free. According to the Health Ministry, individuals can make appointments at 98 private health facilities registered under the ministry's subsidiary Protect Health starting today. The program is specially targeted for the adult population who have just registered and have not been given an appointment, or for those who have missed the first dose or second dose appointment. Other groups will be announced by the Health Ministry later. UMNO President Datuk Sri Ahmad Zahid Hamidi can now fly to Germany for a medical treatment after two courts agreed to temporarily release his passport until November 21st. The Shah Alam High Court today granted the UMNO President's application to leave the country, similar to the one made at the Kuala Lumpur High Court last Thursday.
Lawyer representing Zahid said the temporary release of passport would not affect Zahid's next trial date, which is on October 22nd. The former Deputy Prime Minister suffers from back and neck pain, requiring special treatment from a leading specialist in Munich. He is facing a total of 40 charges, including 33 charges of receiving bribes, totaling to 42 million ringgit from Ultra Kirana Sendirian Berhad in his capacity as civil servant and then Home Minister. 7 other charges is for accepting 3 million ringgit, 75,663 ringgit and 62,115 ringgit in cash from the same company.
The Life Insurance Association of Malaysia has proposed that tax relief for medical and health insurance premiums be increased under Budget 2022. President Loh Guat Lan said this is important so that it will lift the burden of potentially large medical expenses from taxpayers due to the increased risk.
Other than that, she said the cost of medical expenses typically increases with age and taxpayers are utilizing their current income to fund for their future long-term medical needs. Loh said the cost of medical insurance for an average family of 2 adults and 3 children is about 2,500 ringgit per annum at the lower end. Therefore, there is only 500 ringgit savings for premium per annum for this family to support the education policy of the 3 children, which is not enough. She added that given the importance of having health insurance for Malaysians, the tax relief for this type of insurance plan should be increased.
The Wildlife Conservation Bill 2021 was tabled for the first reading in the Dewan Rakyat today. Deputy Minister for Energy and Natural Resources, Dato' Ali Biju, said the bill aims to amend and improve the Wildlife Conservation Act 2010.
The bill would include new provisions, Section 88A and 88B. Under Section 88A, individuals are prohibited from organizing wildlife shows unless with a permit to operate a zoo. Those found guilty is liable to a fine not exceeding 50,000 ringgit, prison for a term not more than 3 years, or both. Section 88B, meanwhile, prohibits promoting any wildlife or its derivatives for business purposes unless with license or special permit. Those found guilty can be fined not less than 50,000 ringgit and not more than 100,000 ringgit, or prison for a term not exceeding 5 years, or both.
There has been lots of progress made towards ending the stigma surrounding mental health and illnesses, but there is still a long way to go. Senior lecturer at University Malaya, Dr. Haris Shah Abdul Hamid says having more open dialogue about mental health conditions will help bring us a step closer to breaking the stigma on mental health.
I believe knowledge is one key area. People sometimes are afraid of things that they do not know. And when they don't know enough, maybe they are afraid of discussing such a topic, and then it becomes a taboo. Yeah, and I think people may also lack experience. Knowledge is one thing. Experience is the active knowledge that we get from interacting with other people. When we don't have enough exposure to mental health cases or people living with mental health, perhaps we are not able to process the information that yes, there are people who live with mental illnesses, and this is what mental illness do to them.
He said it is crucial to provide a safe space to those struggling in silence to talk about their conditions. At the same time, encouraging more talks and courses on mental health will help normalize the conversation in the public sphere and lead to improved access to treatments and services.
Education is very, very important. I'm glad to see that there are many NGOs now that are promoting or advocating mental health. So they are normalizing the discussions about mental health. So I think that's very important. And if we look at research in mental health, we may or we will see, for example, mental health literacy. Yeah, so this can be achieved through many different ways, either through systematic curricula, like one optional subject at the university level, for example, or part of the student association activities. Yeah, either at the school level, at university level, college level, and also perhaps in social media. And I believe social media has a lot of important roles to play with regards to, for example, disseminating information about mental health and also providing role models for speaking about mental health in a healthy manner.
We will go for a quick break. Stay with us.
When the world was changing for photographic film, we helped change the world as a pioneer of the digital age. In healthcare, we're expanding what's possible with advanced technology. But why stop there when we can focus our AI and IoT expertise on business innovation, helping tackle some of the toughest challenges in the workplace? When it comes to innovating for a healthier world and a more sustainable society, we'll never stop. Fujifilm, value from innovation.
New Zealand is the latest country to mandate COVID-19 vaccine for its healthcare workers and teachers. Doctors, nurses and other frontline health workers must be fully vaccinated by December 1st, while everyone working in the education sector who has contact with students must have their 2 doses by January. Many in those professions had already been vaccinated, but the government said it is not leaving anything to chance because the groups deal with sick patients and young children who are not yet approved for the vaccine themselves. About 2.38 million people in New Zealand have so far been fully vaccinated, or about 57% of the eligible population. Prime Minister Jacinda Ardern announced that Auckland would stay in lockdown for at least another week to wait for vaccination levels to rise. New Zealand is bracing for increasing numbers of cases after recording 94 new infections over the weekend. Over in Australia, its largest city, Sydney, reopened today after nearly 4 months of lockdown. Cafes, gyms and restaurants welcome back fully vaccinated customers as Sydney achieved a benchmark of fully vaccinating over 70% of its population. Some businesses even opened at midnight Monday due to demand from people to enjoy their freedom after being in lockdown for more than 100 days. The government promised more restrictions will be removed once vaccination rate hits 80%. New South Wales Premier Dominic Perrottet said the infection rate and numbers of COVID-19 patients being admitted to hospitals were lower than modelling had predicted.
We obviously want to make sure that we look after people's health care, particularly at a time as we will no doubt see case numbers increase. We will see hospitalisations increase, but we've invested significant amounts in our health system. We now need to learn to live alongside the virus.
COVID rules had banned household visits and travel beyond a 5-kilometre zone, separating many families. But most restrictions have now been eased for fully vaccinated people. The United States and Britain warned their citizens to avoid hotels in Afghanistan following a deadly attack at a mosque on Friday. An Islamic State suicide bomber claimed responsibility for the attack that killed at least 46 people. Foreign officers of both the US and UK warned of threats at the Serena Hotel, popular with business travelers and foreign guests. The Serena Hotel has twice been the target of attacks by the Taliban. The UK also advised citizens not to stay in other hotels in Kabul due to increased risks. Since the Taliban takeover, many foreigners have left Afghanistan, but some journalists and aid workers remain in the capital. The Taliban is struggling to contain threats from the Afghanistan chapter of the Islamic State as it transitions from a rebel army to a governing power. At least 5 people have died in severe flooding in China's northern Shanxi province. Torrential rain last week triggered landslides across 70 districts and cities in the province, affecting more than 2 million people. Local authorities say nearly 17,000 homes have collapsed across Shanxi province, while more than 120,000 people have been evacuated. Heavy and prolonged rainfall are also hampering rescue efforts. Shanxi is a major coal-producing province, and the Chinese government was forced to halt operations at mines and chemical factories as a result of the rain. China is already facing an energy shortage, which has caused power cuts. The flooding comes less than 3 months after extreme rains in Henan province left more than 300 people dead. 3 weeks since its eruption, the volcano on Spain's La Palma island was still spewing up endless streams of lava with no signs of ceasing today. Now, over the weekend, parts of the northern face of the volcano's cone collapsed, leading the lava to overflow in different directions. Authorities are on alert as the collapse has also made the volcano become more explosive. More than 1,000 buildings and homes have been destroyed by lava pouring down from the volcano. Nearly 6,000 residents have been evacuated after the initial eruption. Impending Sarawak and Malacca elections raise questions about the need to prioritize democratic practices even in the midst of a pandemic. Tonight on Consider This, we speak to our guests about pandemic elections. That is all we have for you on AWANI tonight. Get the latest news updates on COVID-19 and COVID-19 vaccines from astroawani.com and Astro AWANI app. I'm Cynthia Ng. Thank you for watching.